Hello, thank you for joining us today. I'm Dr. Jennifer Ann Bishop, and I'm a member of the Alumni Weekend Committee. We're proud to have Dr. Amaka Haruna share her work entitled Developing Local Solutions to Local Challenges, the Resilience of Adolescents and Young People Living with HIV in Nigeria. Dr. Amaka Haruna is a public health specialist with over 10 years of experience. She was a member of the transnational African team that spearheaded the execution of the HIV epidemic appraisals, a landmark study in Africa that provided the framework for the design of comprehensive HIV programs for marginalized populations. Over the course of her career, she's had the opportunity to work with several global organizations, including Family Health International, the World Bank, and UNAIDS. Currently, she works for UNFPA as an adolescent health/HIV/AIDS analyst, supporting the Nigerian government in designing innovative solutions to the health and development challenges young people face in Africa's most populous country, Nigeria. I'm going to turn the mic over to Dr. Amaka Haruna.
Thank you very much. This is the title of my presentation, as Jen had said, Local Solutions to Local Challenges, the Resilience of Young People Living with HIV in Nigeria. I'm going to present a little bit of the work I do. I've been doing for a couple of years, and I hope you find it interesting so far. So this is my country. This is Nigeria. It's the most populous African nation with over 200 million people. It also has the second highest number of people living with HIV, and 40% of them are young people between the ages of 10 to 24 years. The HIV response in Nigeria has evolved from an emergency response to a more stable HIV response, just like how eventually the COVID programs we have now will evolve into more stable programming. So while there's no more an emergency, there's now increased focus on preventing new infections, especially prioritizing newborns and adults. However, there is always an important group of people that are left behind whenever there are programs or things are being planned, who seem to, by some chance, be overlooked continuously. And these are adolescents and young people. So why are they often overlooked? And why do adolescents and young people living with HIV, specifically in Nigeria, have some of the challenges they have? First of all, we have a healthcare system that is not tailored to meet their needs. We have healthcare workers that know how to take care of young children and adults, but have never been trained how to take care of adolescents and young people, not to mention those who have a chronic disease like HIV. Secondly, these young people living with HIV have lack purchasing power, and that means that they cannot afford some of the medications and the tests they require to ensure that the drugs they are taking are not causing damage to their system, and they're actually doing better. A lot of young children have support from donor organizations. Their fees are subsidized. Parents cover their fees, and the adults most times can afford their own treatment. But we have a significant gap of young people, a large population who have to take care of themselves from school and have nobody giving them money. And so they can't procure some of the drugs and other tests they need to do. Thirdly, we have a lot of ingrained sociocultural norms and practices that prevents them from accessing information on their sexual and reproductive health. These are young people living with HIV. However, most of them do not practice safe sex with their partners. A lot of them don't know anything about their sexual and reproductive health. And that's because we live in an environment that is not very comfortable discussing such things with young people. And while that is understandable for young people in general, this population cannot afford to not be talked to about their sexual and reproductive health, because by them not using protection or practicing safe sex, they are infecting so many other people. Another issue we have is that, unbelievably, over 70% of young people living with HIV do not know they are living with HIV. Parents have difficulty disclosing to their children that they are HIV positive. And so these children grow up from childhood taking medications every day, but not knowing why they take medications. They tell them it's for different reasons, but no one really addresses this issue to the children. So by the time they're in their 20s and finally they know, makes them spiral into some kind of mental depression because the weight is overwhelming by that time. And lastly, there's lots of lack of social support structures at home, in school, in the community for this unique population of young people who are transiting from childhood to adulthood. And they get no guidance, they get no insight, there's limited information on how to become and transition successfully while also having a chronic condition that affects so many parts of your life. So the result of this is that, first of all, majority, over 80% of young people living with HIV default on their antiretroviral drugs. And these are drugs that people living with HIV need to take every day to ensure that they're healthy, their viral load is not very high. But because they don't know and they're not well supported or counseled, a lot of them take their medicine, they don't take their drugs. And that means that they fall sick more, they cannot comfortably continue their education because they're not on the meds they need to be. Secondly, we have a significantly high rate of pregnancy and unplanned pregnancies and sexually transmitted infections in these young people because they don't use protection. They are not aware of what they need to do to ensure that they have healthy, productive lives. Sadly, we also have an increasing incidence of suicide attempts in this population because of the mental stress that overwhelms them when they find out they are positive. There's also an increased incidence in intergenerational sex, and that's fee for sex between most times older men and young ladies who are positive, that these things make them meet older men that now give them money to support them to buy their drugs and support themselves. And lastly, because of the irregularity of their lives and all the things they go through, a lot of them are having problems finishing school, getting jobs, or even developing skills that will make them marketable in the future. And so these are all the issues that are going on right now in my country. And amidst all that, we have a significant decline in donor funding. Now, over 60% of the money that comes in for HIV programming in Nigeria is from donor organizations from first world countries, the US, the UK, and Europe. Over the last few years, we have seen a significant decline in donor funding. And what that means is that the little free things that these young people could even get, it could be that they were getting test-free, they're test-free, or some other things are going to soon be taken away from them. Going to soon be taken away from them, and it even creates a bigger, bleak future for them going forward. So what has happened now? Given all this scenario, I seem to have painted a very bleak scenario, but it's not all bleak, because we believe that local solutions need to be created to solve local problems. And over a period of 2 years, the young people living with HIV in Nigeria have initiated some of those local solutions aided by technology. So one of the first things they did starting 2 years ago was to initiate a group of them started it, with the support of my organization, UNFPA, to start conducting high-level advocacy visits to policymakers, development partners, and community structures around them, educating them on the needs of young people living with HIV and why it's important that structures are put in place to support young people living with HIV effectively. So that was one of their first steps 2 years ago. The second thing they did with the support of the government, development partners, and others was that they conducted a mapping of health facilities, and they also trained a lot of healthcare workers. Healthcare workers in Nigeria don't even know how to manage adolescents and young people, talk less of those who are positive. So a lot of training and capacity building was done for them to know how to manage the conditions they present with. And they also mapped out the health facilities so that young people living with HIV know the facility they can go to where they can get their drugs and can be adequately supported for themselves. Thirdly, they created support groups. These were physical networks of young people living with HIV for the first time in a country where there are over 200,000 young people living with HIV. This was the first time where they actually connected and knew each other physically. So they formed congregations of support groups in one state. This was initiated in a pilot state, Lagos State, which is the most popular state in Nigeria. These support group hubs were led by trained adolescents and young people living with HIV and domiciled in health facilities where young people could access services. They had an average of 35 to 40 young people. And in those groups, they were able to ask questions they couldn't ask. They can't ask people, adults, they were able to get support for their adherence. There's something in HIV called drug fatigue. It's tiring taking a drug every day, even if you don't need, when you're just ill. Imagine having to take it for the rest of your life. And that's what most young people living with HIV face. So the mental strain of it can be very overwhelming, and most of them stop. But these support groups have been able to create linkages where young people feel supported during the process of taking their drugs, and even linking them up to financial places where they can get financial incentives and training on how to develop their skills. Fourth thing was the creation of virtual networks. This is where technology came into place. Now, these young people created innovative ways to be able to connect themselves virtually. They use social media platforms, WhatsApp, Facebook, to connect themselves to each other where they were living, those who were living in separate places to connect each other. They also developed an app whereby they could ask questions freely. For example, my boyfriend wants to have sex and he doesn't want to use a condom. What do I do? Or secondly, I haven't told my boyfriend that I'm HIV positive. How do I tell him? These are things they cannot ask adults or healthcare workers. But when they congregate and have these safe spaces to discuss, they are able to share information, vital information that could change their lives. Right now, there's a network of about 4,000 young people registered in these virtual networks and providing support to each other. So the results thus far over the last 2 years, we have seen a significant increase in the adherence to the antiretroviral drugs. There's also been an increase in the knowledge about their sexual and reproductive health, enabling them to transition better from childhood to adulthood. And thirdly, we have an increased number of health centers with the capacity to now manage adolescents and young people living with HIV, meaning that when a young person with HIV presents at the health facility, the healthcare worker doesn't run away anymore. Instead, she knows what to do and how to manage them. So those are great success results for us. Currently, it's being scaled up. Initially, from now, we have about 65 support groups. And over the next few years, we hope to scale it up to about 250 support groups where at least 20,000 young people living with HIV is estimated will be connected. It is our belief that these support groups will better strengthen service delivery for this unique population and also help them to develop better as individuals living in a world or a country that is not well structured to them, but we believe that they can now adapt themselves to the country and still be able to contribute as able members of society. So thank you very much.
Thank you, Dr. Amaka Haruna. Your work is absolutely amazing, and I'm just so pleased that you decided to share it with us. Wanted to just ask you a few questions about some of the critical points that you highlighted in your presentation. And the first one that I wanted to bring up was, what are some of the ways that adolescents have found to overcome some of the challenges that you mentioned in your presentation? You had noted that they're having difficulty purchasing drugs and resources. And can you share some of the strategies that you've observed over time?
Yeah, so for those things, they've been able to form community groups. Through this work they do, first of all, the advocacy, they've been able to, advocacy visits they've been able to initiate to private sector entities, community organizations, and through those mechanisms, they'll be able to raise funds to be able to procure drugs, procure their tests, and other support materials that they need. So that's one of the big challenges they have because, as I said, they're not financially empowered. But through, so those are some of the challenges, but through their advocacy and also work with development organizations who have begun to actively engage government to begin to, first of all, produce some of those drugs locally, because why they're so expensive is that they're not produced locally. So through the work of these young people, the government has started looking into creating factories that can develop these drugs locally, bearing in mind that very soon the donor funding will end and we need to provide these resources locally.
Excellent, thank you. So another question I had, it actually built off of your conversation about the use of support groups and also the creation of the virtual networks. And I just wanted to ask, have those been evaluated to identify what are some of the key successes that have come out of them, and whether or not, you've mentioned it's being scaled up, but whether or not it can be replicated elsewhere, maybe in Africa?
Yes. So, I mean, we have not conducted any formal evaluation. It's more of word of mouth of the participants, apart from the adherence rates and things like that, But it has been very successful. First of all, the terrain in Nigeria can be pretty rough for those who work in Nigeria. So, there's a saying that if it can be done in Nigeria, it can be done anywhere. So, I mean, anecdotally, I'll say that, if we could, because the Nigerian, there are a lot of obstacles to overcome, in Nigeria. But at the same time, Nigeria is also a bit more financially buoyant than most countries, most African countries. But we believe that it's a relatively simple model that can be scaled up, because it's using technology that young people use all the time, because they use more of the technological platforms than even the physical. So it doesn't at times cost as much. And because it's a social thing, they're able to quickly connect with each other and aggregate. Everybody is always looking for a space to be accepted. So I think that's one of the bases, looking for someone to be accepted. And when they find that space, somehow they get more comfortable and they find their friends to join. And it kind of grows into a bigger ball of things like that. A lot of times, I mean, they have, because these are associations, so they have networks in neighboring countries where some people, because it's virtual, they just join in, even though they are not in the country. So we believe it's something that can be easily scaled up, first of all, within Nigeria, because this is only within one state now, and then hopefully West Africa and Sub-Saharan Africa at some point.
Excellent. And my final question for you is, so now what? You've really done an excellent job in spelling out this issue for this at-risk group. If there's a message that you wanted to give to others to support the work that you're doing, what would you say is kind of the next step? What do you really want us to take away from your presentation?
Okay. I really want, I would like to say not the world, but at least the HSPH alumni, to know that there's no greater solution for problems than local solutions. And Africa has been a country that, Africa has been a continent that over years has continually been supported with solutions that come from overseas. But we found that what is really sustainable and what is really going to stand the test of time are solutions that are thought of and brought about by those who are most impacted by the issues. And that is what's going to stand the test of time. That's what's going to be sustainable. And that's what those countries are going to eventually use, be whatever the health issue is. So that's what I think this little pilot shows. And I hope everybody here remembers at least my last words, that whenever you have the opportunity to support countries who are not top of maybe third world countries or countries who are not as developed, always encourage local solutions to their local problems. Thank you.